So hello and thank you for joining us for our Feed, Read, and Grow Lactation Support Education Series. I'm Sheila Umberger and I'm the Director of the Roanoke City Libraries. And I'm joined by Dr. Cameron Johnson. Dr. Johnson is a local pediatrician and lactation consultant here in Roanoke, Virginia. Thank you for joining me, Dr. Johnson.
Glad to be here.
Let's start off by talking a little bit about the struggles that you see moms having when they start breastfeeding, and what advice would you give women who are about to start breastfeeding, and what is important for mothers to know before they begin?
Oh, there's so many things in that process. I think the hardest part about breastfeeding is recognizing that you need help and accepting that help. There are lots of processes that go in this, and there's a lot of new changes that are coming in terms of the changes in the household with a new baby. And so sometimes lactation goes really well and sometimes it doesn't. And knowing that you have the resources from family and friends and our community, your physician, goes a really long way to be able to help that process. Sometimes everything happens unicorns and rainbows. It's just lovely and easy to do. And sometimes it's not, but you do have the support out there. And our community is very blessed with lots of people who can help with that process. So if someone has questions, reaching out is really important. The hardest part about having a new baby is the sleep. You're just tired, right? And adding to the questions and the worries about, am I getting enough milk? Do I have enough milk? Is my baby doing okay? Can add a lot of worry into that process. And there's a lot of things that can be done to kind of watch that process so that we know that the baby's doing well and mommy's doing well. So I'd love to tell you there's an easy way to prepare, right? You just do these 4 things and everything will go beautifully. And sometimes it does and sometimes it doesn't. But there are lots of resources that we can use.
Well, that's really, really great to know, because from your years of experience, would you mind talking about some of the struggles that you see moms experiencing, you know, when it's not unicorns and
rainbows,
when starting to breastfeed their babies?
Yeah. So there's a couple things that we know that work really well to help initiate a good lactation journey. So one of which is getting the baby to the breast pretty soon after delivery. And the hospitals in our area do a really good job of trying their best to get the baby supported and to the breast for that good latch within the first hour or 2 following delivery. We know very clearly that that helps to change mom's hormone balance, and babies are really awake at that time period. So if you can get them to go to the breast within that first couple hours, it makes a huge impact in being able to establish that supply. The lactation consultants in our area do a great job of helping moms get the baby onto the breast in those first couple days. And then there's a lot of patience waiting for our milk to come in.
Right.
And there's not a whole lot you can do in those first couple days except practice getting the baby to the breast. And that's really what it is practice.
Right.
And sometimes it works and sometimes you have to try again. And the nice part about it is you get to try again in another couple hours.
Right.
So I would, again, use the resources available in the hospitals or the birthing centers to try and make that a good start.
So you talked about how important it is for a mother to have a good latch.
Yeah.
What are some of the things that would signal that there's something off or that needs to be corrected about that latch, that it's not that good latch?
That's a great question. The biggest way that we can tell if there's a good latch is if mom doesn't have pain. Because if it's painful, that usually means that there is too much friction right at the tip of the nipple where it's more sensitive. So the good latch with the mouth being really big and wide, with baby's nose and chin touching the breast tissue. But also making sure that you're hearing those swallows like we talked about before. Now that pain for mom can be a couple things. It can be that mom has some scar tissue there. It can be that mom has some skin irritation there. It can be that the baby is having trouble getting the breast into the right position in their mouth. Sometimes that's because their mouth is small. Sometimes it can be because their tongue is not moving appropriately. And all of those things require a further evaluation. So if mom's having pain, we need to look further. It really shouldn't be painful. It should feel like a tug, and that's it.
So you mentioned that. That's interesting because there are a lot of myths around breastfeeding that can intimidate a young mom. And can you speak about some of these myths?
So I will speak to some of the things that people tell me about. A couple of times people will say, well, my mom and my sister and my grandmother weren't able to nurse, so I'm not going to be able to. Or size truly doesn't matter, and there are lots of things that can go into that, whether it's a NICU baby who hasn't been able to feed directly at the breast, or if mom has had some surgeries or so on and so forth. There are some cases where moms don't make enough milk, but those are usually identifiable reasons for why, and there are some reasons why babies have a hard time latching too. I keep coming back to the latch because that latch is so important. It makes all the difference in the world. A bad latch doesn't help mom or baby, doesn't get the milk supply in, and it's harder for babies to be able to transfer the milk with a bad latch. So getting that in a good space early on makes a huge difference. So one of the issues that can happen is people will feel like they don't have enough milk because they haven't been able to get that good latch in the first, say, hour or two. And being able to address that in a different way is important. Some moms will say they don't want to or are not able to breastfeed because they have to go back to work at a month, 6 weeks, 8 weeks. And there are lots of ways that you can help support that breastfeeding journey or that feeding of the baby either at the breast or with pumped milk, even once moms return back to work. It's not an all or nothing. So sometimes we have to supplement with either a donor milk or formula to be able to allow mom to be able to get back to work as well as be able to feed the baby.
Okay. Well, you're certainly a wealth of information. It's very helpful. Good start. So what are some local resources that moms might not know about that you can recommend to help with some of the challenges?
So our area is blessed with a growing number of people who are very well versed in helping moms. Some of that started off with the formula shortage that we had this summer when there was so little access that people really started to recognize the benefits of breastfeeding and human milk feeding. And the resources in our area have really grown from individual physicians who are interested in breastfeeding. There's lactation consultants at all of the birthing centers and the hospitals. There are some that are in private practice and will go to families' homes. And then there's also some really good organizations in our area. So one in particular is Breast Roanoke, which supports moms in their breastfeeding journey. Huddle Up Moms is another great resource that has so many opportunities to support moms, both with lactation and postpartum depression and lots of other resources as well. The Latch League in our area has some group resources as well.
Well, thank you. That's all very helpful information. So we live in a resource-rich community here in the Roanoke Valley, and you're part of that support for our parents and our children, so help them grow healthy and strong. So Dr. Johnson, we're really happy and thank you for joining us today, and we look forward to hearing from you some more.
Thank you.
Thank you.